I'll jump back to the conclusion. The Headwaters EMS is the only ambulance service within the 3 towns, and they have proven their ability to respond to calls for EMS 24 hours a day, 7 days a week, with an average response time of 12 minutes under municipal contracts. The applicant, based on its application to the REMSCO, has proven need as defined in DOH Policy Statement 0606. Specifically, there is a demonstrated absence, reduced availability, or an inadequate level of care. Further, there appears to be little opposition to the application to grant Headwaters EMS Incorporated an authority to operate an ambulance service in the towns of Stamford, Courtright, and Harpersfield in Delaware County. Therefore, it is my opinion that the applicant has demonstrated need for ambulance operating authority in the towns of Stamford, Courtright, and Harpersfield in Delaware County. Respectfully submitted, Lee Burns.
Mr. Penske?
Yes.
Anything you want to?
Yes, if I may. My name's Brad Pinsky. I'm the attorney for Headwaters. I was asked to come because Ray has a conflict to answer a couple of questions. Again, my name's Brad Pinsky. I'm the attorney for Headwaters. I was asked to come. Obviously, Ray has a conflict, he can't speak. I'm told there were a couple of quick questions that needed some answering about the process and why Headwaters went the way it went. So one question I was asked to address was whether or why, if the towns have a municipal CON, does Headwaters need the CON? The plan, when I was brought in, was never for the municipalities to be in the ambulance business. None of them wanted to do it. But we needed to get moving. Response times, response mattered, Headwaters was ready to go, so we had to get going. But the CON process is not a quick process, so it was much easier in 30 days to get 2 of the 3 municipalities municipal CONs so that they could then arrange for service. But none of the municipalities are going to be renewing or asking for a permanent CON. They'll be abandoning their CONs because that was always the plan. The service, as Ms. Burns found, is responding well. There are over 630 calls since inception. They've lowered response times, which far exceeded 30 minutes, down to 12 minutes. In many cases, there was an hour response time because there's just no ambulances there. So they have really met need. There's been no opposition. I handed in a couple more letters of support that were received a while ago, just didn't make it here. But we're not aware of any opposition to the application. And in a time when ambulance services are dying out, it's great to see this one is succeeding in addressing public need. So unless there's any other questions, that's what we were asked to address with you.
You can stay here. Just obviously. Any other discussion? Any questions?
I have some if nobody else does. So I went through all 125 pages of it. I'm just trying to make sense of stuff. So I appreciate your explanation. How is Headwaters operating without a CON?
Headwaters was, the DOH asked me the same thing. I'll share with you the conversation. They said, how is this possible? I said, how is it not? Steve Desoy and I had this conversation. I said, a municipality is permitted under General Municipal Law 122B to contract with an ambulance service or with any group of members or any corporation capable of staffing. So the answer is General Municipal Law 122B.
Right, so I'm aware of that, but essentially what currently exists then is 3 separate agencies that are already existing that are subcontracting with this private entity to provide service in each of those spots.
Correct.
We're still talking about 1 ambulance to cover all 3 though, right?
Yeah, the call
So
volume,
it's
well,
the
it's 2
same
ambulances. They own 2.
Right, how many are actually staffed?
1 at the present time, and then they're looking if the need requires it to staff the second. But right now, they're doing on average. Yeah.
And again, forgive me, I'm just trying to get a picture of what's going on. So really, you have 3 agencies that are contracting the same ambulance to cover all three of their towns simultaneously.
Correct. Nothing unusual about that, I mean, it's,
Well,
AMR covers, you
it's
know, the
unusual,
county.
it's unusual, it's just not improper. So,
Yeah.
because really each of those townships are operating their own muni CON,
Yes,
and then subcontracting at the same time with the same physical ambulance to cover all three, even though all three can't possibly use it at once.
correct, if there's,
Right, okay. Okay, so then, so there really is no CON currently for Headwaters. This is a new application.
Correct.
Okay. The box was checked on the application that it did not receive governmental funding.
correct.
But as you just stated, it's funded through 3 governmental municipal.
No, it's not, actually, its funding is through billing and through a grant, it was a private grant. There
Okay.
may be funding in the future, but it's
So
not
there's-
funded today.
There's no contract or payment from these 3 townships.
There's a contract, there's no payment,
There's contract, no payment. So in other words, they're subcontracting out their CON.
yes, effectively.
Alex, can you subcontract a CON?
Yeah.
Not just the work for it, because I know you can subcontract out to like do the ops itself, but can you essentially loan your CON out?
It's contracting out, to my
Yeah.
understanding, yes.
Okay,
It's happened in Shenango County when towns of New Berlin, Village of New Berlin, and Town of Columbus all did that with Unadilla Valley Emergency Services.
okay,
That was the same thing.
okay.
But it's not common, so your questions
Yeah.
are dead on.
Yeah, I'm just trying to understand it, that's all. Okay. I guess that's my only questions. I have questions otherwise, but I don't think they necessarily need to be brought up.
Any other discussion? Last chance. All right, we'll have a roll call vote for the motion.
The motion again, resolve that public need has been shown to exist for Headwaters EMS to obtain a permanent certificate of need to operate their ambulance service, with the service primary operating territory being the towns of Harpersfield, Courtright, and Stamford in their entirety. This will be pending the New York State Department of Health Bureau of Emergency Medical Services and Trauma Systems Operating Certificate Application Processes Policies 30-day window for appeals. A yes vote indicates that you support the application, a no vote indicates that you do not support the application. And abstention's an abstention. Tara George.
Yes.
David Simmons.
Yes.
Rebecca Dinino.
Yes.
John Farquhar.
Yes.
Jim McCready.
Yes.
Mark Souza.
Yes.
David Brennan.
Yes.
Jill Dunham.
Yes.
Ken Kirk.
Yes.
I believe Josh Wells is not present, so Carl Turner.
Yes.
Ken Chakosky.
Yes.
Thomas Pasquarelli.
Yes.
Aaron Robinson.
Yes.
Michael Schwartz.
Yes.
Sidney Chase.
Yes.
Victor Jones.
Yes.
Elizabeth McGowan votes yes. Damon West.
Yes.
Dan Bixby.
Yes.
Owen Hahn.
Yeah.
Howard Huth.
Yes.
The vote is 21 yes, no noes, no abstentions. And it meets the majority of the entire members authorized to vote threshold.
So motion carries. State council report.
Let's get them back in
Oh,
first.
Jill, are you leaving, Brad?
I would, unless you need.
No, we don't. Can you just send them back in?
Yes.
Brad, I just want to show you something before you leave. I'll walk out with you.
All right, state council report. There is no state council.
Let's tell Mr. Baker that.
Oh, yes, your motion has passed.
Okay, thank you.
There was no state council meeting yet. It's on another month and a half. REMAC. Montgomery County, their ambulance division was granted their ALS approval. The combination remote and ARMS REMAC committees met on March 6th. They are now up to, they approved Dr. Stephen Hassett, so they are up to 7 physicians, which is good news. Hartwood Fire Department Emergency Squad provided an application for approval of service to go to the ALS paramedic level. After discussion, a motion was made, and it was resolved that the Hartwood Fire Department Emergency Squad application for approval for service provide paramedic level is approved. Stanford Joint Fire District received their 3C controlled substance license, but ARMS has not received any regionally required paperwork for the upgrade as of this point. Once that happens, we'll be able to act on it.
Okay, and Mr. Curbello has given me paperwork since that REMAC meeting, so we'll be able to bring it to the April 3rd meeting.
For those of you who are familiar with the Muru app, Dr. Markowitz asked if he could have, or if there could be an ARM-specific section on that app, and I think he was checking into that. Dr. Markowitz has also asked for a physician to take over his CMAC seat. He is willing to serve until a replacement is found. He doesn't want the region to go without representation at a state level. Discussion about the DNR and MOLST orders. If an EMS provider believes in good faith there is a DNR/MOLST form and they do not resuscitate, they are indemnified. There is a new MOLST class on Vital Signs Academy. It has the most current information regarding the new form and the changes in legislation around the healthcare proxy decision-making capabilities. REMAC is considering adding an education requirement for 4 hours for physician-led education each year. And that their next meeting will be held on April 3rd via Zoom.
You don't have anything to report from nominee? Okay.
We meet on May 2nd. We meet on May 2nd.
April 2nd?
April 2nd.
Whatever that is, yeah, April 2nd. And we go forward with the nominations to you.
Okay.
County reports, Delaware?
A new agency. So, and starting up our spring EMT classes and things.
Just to remind you, there is a 30-day waiting period where it's open to appeals. So you won't see your certificate until after that. Okay?
At Seago.
Currently have 3 EMT original refreshers running, and a EMT core contact.
Mr. Harry? Montgomery, we have an EMT class starting April 1st in Amsterdam. Anything else to think of? Nick?
No, just from a hospital point of view, we're switching providers. So we're losing team health and going to core. So if you deliver to us, you'll be dropping patients off, you'll be seeing some new providers. That starts Sunday.
Fulton?
What hospital is that?
St. Mary's.
Okay, thank you.
We have a EMT core class this Saturday. That's it.
Hamilton?
Nothing new report.
Easy peasy. Any old business?
Just the website, that there was no update.
Any new business?
Yeah, so I didn't want to bring it up during the CON because I really don't think it applies, but I think it would behoove us all to go over how we go procedurally from having an ambulance service and then the level that that ambulance service or first response service can provide care. And, you know, all I have are stories, but it sounds like through good effort to just provide patient care and the proper patient care, there's some lines that have been blurred in Delaware County. And I think for the safety of providers and the agencies, it would probably be really smart for people to understand the process. So like, the short version of it is a CON gives you the ability to operate. And Alex, jump in here at any point in time if I'm misspeaking, please. But if you're going to go to an ALS level, those are dictated by the regions. So you make clear what you need, you know, operationally at the state level, but you still need to apply through the region, through the REMAC, and be approved to operate at that level. So if you're not cleared by the region and the state, you should not be performing care at that level. If you are, you're doing so improperly and without the credentialing to do so, with the ability to do so. Additionally, and this is something I brought up, you know, I was in a position where I was a member of two different agencies, and one was ALS and one was BLS, and at times you'd go, oh, well, we need a paramedic, and you'd figure it out. I get a distinct feeling like that's happening in Delaware County. If it is, there needs to be clear separation between church and state. So hypothetically speaking, if you're getting paid as an EMT, but you are a paramedic on a transporting ambulance, and you do an ALS intercept that happens to be with yourself as a volunteer from the ALS First Response Agency, you need to clearly delineate that you are operating as an ALS provider with the ALS agency. If you're not, you're practicing medicine without a license. Alex?
So you can practice up to the level of that agency with that agency. If you do like an intercept or you're working with the other agency, it has to be very clearly defined that which agency you are working with and working under.
So like
and
two different charts.
Documentation too.
Two different charts, right? You're not writing BLS chart and the ALS chart. Somebody else is writing the BLS chart, or there is no BLS provider in the back of the ambulance while you're the ALS provider. You're not being paid by the BLS agency to be an EMT while you're acting as a paramedic for another agency. That line has to be clear. If it's not, you're putting yourself at risk. So if that's been going on, there's nothing formal that's been brought forward, so that's cool. And if it's then everybody in this room has the education now to not do that. That's it.
Any other new business?
I don't know if this is new or old, but you mentioned new protocols coming out. Are they out now? Can it be reviewed? Can they be reviewed anywhere? Or?
I'm gonna ask Alex to come to the table for this one, please.
So they have not been posted yet. They should be up anytime now. We're working through the internal processes at the state level to get those on the website, but they will be on before the implementation, so agencies can go through them, train. And again, like the last update, we had a change log. So that change log had exactly what's changed in the protocols, and it'll make it easier to be able to review them as well, for both the collaborative and the BLS.
On behalf of the protocol committee, I think you'll like what we're doing with this now, because instead of just fixing it as we go, trying to kind of stay up on medicine, we've pushed it out now to an annual update. So every agency should be able to plan that at this point in time, it's gonna be passed through the committee, then to the state, and then eligible to get out and published and go from there. They're also now, Dr. Cushman has turned around and he's gonna deliver the proposed changes to either the training and ed committee or education members on the protocol committee to actually cross-reference to make sure that the protocols that the physicians are trying to pass are actually in our scope of practice. Well, recently we had an issue where somebody granted a change to FDNY's protocols, and the problem is that they didn't match national standard education points for that level of care. It was good common sense approach, it was good medicine, it just didn't match the scope of practice. So essentially what happens is by creating state protocol and then getting it voted through the CMAC and REMSCO, you change the scope of practice now in New York State for that level, and now you have to go back and redo training and education and classes and testing and everything was it, and it was horse before cart, et cetera. So it should be a good process when it's done.
Any other new business? The only thing I have, and we're throwing this out there somewhat early, October 17th is one of our AREMS meeting dates. We are looking to push that off a week to October 24th for two reasons. That's the week of vital signs, number one, and number two, the three of us are not able to attend on the 17th. So just put it out there, look and make sure that is good with everybody, moving it to the 24th, and we'll touch base on that next month. If there's no other new business, I'll take a motion to adjourn.
The next meeting will be at 1:00 p.m. on April 18th, 2024 at SUNY Cobleskill Champlin Hall in Cobleskill, New York. I will send out a map with the where to park and where the meeting is. Off the road. I'm gonna just put there's no anyone else would like to sign the card for Phil, please come do so. Hazel. Sydney Chase. I want to take pictures of the masters. I will see you tomorrow. Yeah.
Right, well, I get it.
Yeah, George. I'll call you to go over everything. Okay? Yeah.
So
I don't know.
Yeah, there's one in particular.
No, they're all on
It's a lot better as a paramedic to be in the field and these patients need care. Right, been there, done that. So I was telling others, I used to volunteer with the U.S. agency, being as a paramedic in the same township.
And a rain date is.
Okay. How do I get a mission like?
So we have a team that's part that are make sure
I do. What's going on next week? I can't do Monday. That's the only thing. Okay. Can we play for like Wednesday or Thursday?
unless you're running town funding
Yeah,
eventually.
Wednesday? Wednesday at 1? There's one where I can do earlier.
Okay. So that, I said to Pinsky.
Oh, no, and I agree completely.
It's checked out, it's not municipally funded, but it has to be listed. Right. Right.
Too long.
So that's what I said.
No, I've seen.
Right, and that's exactly it. I said to him,
We're talking about our medical journey.
I read all 125 pages of this. This is weird. I don't think it's in it's
What is your preference?
right.
I have a meeting at 8:30 and I go to a lunch and I.
Right, and now,
You wanna do it now?
I know.